I stood up to go to the bathroom, and when I stood up, I peed on myself. So I was like, ugh. Let me just track these in case it is some contraction every 4 minutes. Pretty consistently and lasting like 30 seconds. And then he was like, no, this bed, the hospital, she's staying here.
Oh, we ran over our head.
Told us that I was going to be there for 3 weeks. We're wrapping our mind around it, and I still was, I feel like I was still pretty calm.
Yeah, you were way calmer than me. I was at the lowest of the low points. They told me it was something wrong with my child. They told me he was coming early, and they told me something wrong with my woman. It's just like, what else does a man have? You know what I mean?
I was like, okay, 3 weeks in the hospital. I'm still thinking that everything will be fine because I still didn't have a reason to feel like it wouldn't be fine. They gave me magnesium to delay the contractions and everything. They gave me a couple of other things as well. And then once I got up into the labor and delivery room where they did more of the treatments, they actually gave me a shot in one of my buttocks. And that was for his lung development. And then 12 hours later, I was supposed to get another one in the other side. They gave me some IVs in triage. And then they put me on the wheelchair and wheeled me up to labor and delivery to do some more of the treatments.
There you go.
And that's where they gave me.
The purpose of sending her there was just in case she did have the baby. They wanted to make sure that they watched her to see if she progressed anymore. But this is like just a personal gripe of mine. At no point did anybody ever check to see if she was dilated any further beyond that first time.
So we're now in the labor and delivery room. They just hooked like extra cords onto the IV that I already had, and that was for the magnesium, and that's where I got the shot.
The other shots were antibiotics.
Yes, antibiotics and shots. Antibiotics, steroids, magnesium, and the labor stopping. So there was a lot of fluids that were going on.
So we were in labor and delivery for about another 2 to 3 hours, and then they sent
I got the sonogram.
A person in to come do the sonogram, which was super problematic for me. I'll let her tell you why.
So I'm getting the sonogram, and they're looking for the baby, and so she's here and she's rubbed the gel on there and she's looking for the baby, and the screen's over here and we're not seeing anything yet, and she just keeps going like lower and lower and lower and lower till she's literally like
on top of the pelvis.
Yes.
Below the waistline.
Yes.
Below the panty line.
Yeah.
Like she was on the uterus, and she was trying to find his head, but she couldn't find his head. Right. And she just, like she said, she just kept going lower. And then that's when
she was like in between my legs, basically. Like the part that's shaped like this.
Yeah.
This is where she was. She was right here. And
that's the time when I asked, I was like, hey,
she said, there's the head.
She said, she was even surprised when she saw the head there. And then that's when I asked, hey, should his head be right there? And then she's like, yeah, of course, if his feet were there, he'd reach. I'm like, no, should it be that low? To which I don't think I ever got an answer.
Yeah, and I will say partly that sonographers aren't allowed to...
yeah, she said she had to go see the doctor,
and
the doctor would get back to us.
Yes, so they're not supposed to really tell you anything. But his head was way down there, like...
He's about to come out!
So yeah, so then I'm like, huh. Also at this point, I threw up because the magnesium made me so hot. It felt like lava was like flowing through my body. I was like insanely hot, and it felt horrible. So I ended up throwing up. But I feel like I was a champ about it. I like threw up and I was like, let's keep going. Like keep going with the sonogram.
I felt like lava was flowing through my body when I was a champ. Boy, if you don't get your food.
But I didn't like...
Lava.
It felt like lava, but I wasn't like going like this. I wasn't like
bing, 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 bing. Exaggerator. Go ahead. I'm sorry.
It felt so.
I didn't go through it, so maybe it did feel like lava.
It did.
Yeah. But you know what though? This is like a very important and crucial part that I hope other people that take something from this story actually received. Be honest with the nurses and the practitioners that are assisting you, because they kept asking her how much pain she was in, and you heard how she just described the magnesium as lava. She kept describing everything. They said on a scale of 1 to 10, 10 being the highest, how do you feel? She kept saying a 2. Oh, I'm a 2, or about a 4 or something like that. And I think that's what actually contributed to us being shipped off to a different room, because she wasn't letting them know just how much pain she was actually in, or at the very least, she didn't want to. You didn't want to accept it.
It was partly still the denial,
Yeah.
but then also that stress induces labor. So I was purposefully trying to remain calm. So when I would have a contraction, I was trying to just breathe through it. They gave me medication to stave off.
Them contractions was on top of each other too.
At the end.
I'm talking about they was 2 minutes apart. But they was
But
like boom,
okay, so
boom,
then
boom, boom, boom.
When we rode in the car, they were 4 minutes apart. Then they gave me that stuff. They did kind of die down. And so I was getting them less often. I was like, okay, they gave me this stuff. Like, let me also calm down so that I don't like ramp up the contractions. Plus, I'm still in denial. And I'm like, okay, to give birth, like you hear all these stories about how much it hurts. If 10 is like the actual giving birth, then what I'm feeling is not that. Like, let me not over and like dramatize it so that it's not like all crazy. So I ended up underestimating how much, the pain was. So yeah, I was saying like a 2 and things like that.
Which got us moved to a different room, which was going to be the patient room where she stayed for the next
high risk unit
3 weeks.
Yeah, and that was where I was going to just be for the next 3 weeks. So I got in there, I was getting settled down. I actually was getting ready to fall asleep. So we had wrote down a list, and you were going to go home and like get me all the stuff that I was going to need for the next 3 weeks.
Yeah, I actually went downstairs and got something to eat and everything.
Mm-hmm.
Yeah.
And that's when I had kind of like dozed off and everything. The contractions had definitely died down because I was like able to sleep for a little bit. And by the time you got back, and he was like asking me did I want some wings and stuff, because it's like these wings at the hospital.
Bro, them wings at the hospital go, bro.
Oh my gosh, you cannot
That's so good, bro. One time, like after we had left the hospital, at lunch, I went back to the hospital for the wings. Yo, they get busy. Boy, the wings so good, boy.
It's like crazy.
Boy, they good, dog. And the price, you can't beat it.
The price was good.
Boy, you know, with a whole container of wings for like $10.
It was a lot of wings, and they were smoked too.
Smoked. They had them with the convection joints.
Ooh. Get some next time we over out that way.
I'm with it. Say less.
I'm not trying to pay for parking. He went down, got some food, and came back up, and he was like, babe, you gotta try these wings, bro. These wings good. You gotta try.
That's not what I said. I said these wings good as hell. If you gonna quote me.
I wasn't trying to cut.
Quote me right. Yeah.
Alright, he was like, these wings good as hell.
You gotta give
some.
Got to.
And I was like, starting to have the contractions again at this point, so I was like, no, like I'm just chilling, like I'm not trying to eat no wings. Like, let me just relax.
Right, I was over there throwing down. Like, all right, cool. All right, go ahead.
Yeah, and then because I was like, and even though I was having contractions and I was tracking them, I was putting them on the app, I was writing it on the sheet that they gave me, I was still cool and calm because I was like, I'm not having the baby. It's still too early, and they gave me stuff that I have the baby. So okay, contraction too. Like I don't care. So I'm like chilling, not trying to eat the wings though. And then next thing you know, so like I would say the contractions were like 5 minutes apart, and then next thing you know was like, and I would say the level was like a 3 or a 4. Next thing you know, every contraction was a higher level of pain, to the point where it was like every single one was like worse and worse and worse. And he was like, you were so good, babe, because you were like helping me to like breathe through it and everything.
Yeah.
You could put the wings down.
Yeah.
And you were
I
like, and y'all, it's so good that he actually went and got those instead of going home, because he would have like missed it.
I would have missed the whole thing. There's
Actually,
no way I would have made it back.
What even would have happened? Because you the one that went and got the nurse.
Yeah. We could have lost the baby.
You went and got the nurse because
the
I started having like crazy contractions.
And
it was everyone was worse than the one before, to where I was like
let me have just a moment on this piece right here, right?
Right.
So let me get vivid with it. And let me paint this picture. We're in a small hospital room. Her bed is in the middle of the room, and there's like the seating area off to the left side where I'm sitting. She has the contractions. She was still using her app, but then she ends up, I believe, passing it over to me, and then now I'm using the app or whatever, and she's explaining to me how to use it. No. At this time, we're writing it down on paper. We don't have the app out anymore.
Yeah.
I noticed that the contractions are getting closer and closer and closer.
And it was harder and harder.
It was harder and harder, but the whole goal was to stave off actually having the child. So it's like, you still got to remain calm. You still got to be in that moment. But with each and every, I'm sorry, baby. I'm sorry. I got to get in this. With each and every contraction, the noises that she made got more and more guttural. Like, it was visceral. It was coming out. Yo, it was damn near it was demonic, yo. Like, yo, she put both her feet. She was so cool the entire time. Yo, she put both of her feet down flat on the bed, and like she just started like writhing up and like pushing her pelvis up, and it was just like, this is insane. Now, at this point, this is where I'm gonna drop a PSA for black men. There was a story recently about a black man who was at a hospital with his wife that was giving birth, and his wife was having challenges, and because he feared being perceived as a violent, aggressive, non-contributing part of the process, he contained his sense of urgency, and he didn't actually not even express, because he told people what was going on, but he didn't make them, the way he could have, come see about his wife when stuff was happening. And I had that exact same response. I was so much bigger than all of the doctors that were there, and all of the nurses were women except for like maybe 2. And I don't know what the hell is going on. These people are seasoned professionals. I look to them for guidance on how to handle the situation, how to assess how severe the circumstances are. And when they tell me, oh, things are fine, just give it time, this is what's supposed to be happening, it's like you try to take that at face value. But just like that man, I watched my wife in pain, and I knew I was supposed to be doing something. I knew I was supposed to be louder. I knew I was supposed to be more active, and I was supposed to go and like even just grab somebody by they damn collar and say, yo, come see about my woman. But because I didn't want anyone to view me the same way that black man didn't want anyone to view him, I almost let things go too far with Taylor. Now, there did come a point when I didn't care how I was viewed. There was only one woman working our floor, and I was still respectful. I was using the proper nomenclature, and I was being persistent about her coming to see Taylor. But then it got to a point when Taylor started saying the baby is coming, that like all of those inhibitions, all of that fear of being feared, fear of being incorrectly accused of being aggressive, all that went out the window. And to every single black woman, to every single black man, it doesn't matter how they view you. If you need help, get the help. Even if you have to be loud, even if you have to be aggressive. Like, it doesn't matter as long as everything gets the proper attention it deserves. And Yo, that's the only thing that prevented Taylor and possibly the baby from dying in the end. Because when the nurse finally did come in, and she wasn't even doing nothing. She was helping. She was taking food to people. And she kept telling me, hold on, I got to take food to these patients. Hold on. She did it like 3 different times. She had to take food to different people. And to get food, she has to go like to the galley and then come back with trays. Like, it was a long time that was passing. And when she finally did come in and check Taylor and she pulled back the cover, there was blood between Taylor's legs running down into the bed. And my heart like landed on the floor. And I start walking back and forth, pacing like something out of a movie. And I was like, yo, that's a lot of blood. That's a lot of blood. Like, I'm literally saying this, not thinking it. I'm saying it out loud. It's blood. That's a lot of blood. And then at the same time, I'm cognizant of the fact that Taylor needs to be calm. So then I start trying to supersede what I said before, with there being a lot of blood, to saying, Taylor, it's cool, babe. It's all good. Don't worry. It looks fine. It looks fine. And I was like, babe, everything good. Everything fine. Don't worry. We're going to get the doctor up here, babe. Just chill. And then the nurse calls for the doctor. The doctor comes in. She sticks her fingers, I guess, inside the uterus. I don't know. And then that's it. And then we had to go.
Yeah. It was like, to me, I was just laying there and I was still having contractions. So I was not really in all of these moments. So all I know is that it seemed like as soon as the nurse came in, she said, oh, we need to go. I mean, the doctor. As soon as the doctor came in, she said, oh, we need to go.
And then it was so sad. Taylor was in so much pain. She asked the doctor if it was possible to still get an epidural. And the doctor said it was too late. But the reason it was too late was because they never checked to see if she was dilated again. The reason it was too late was because every time I went out into the hallway and I said, yo, she needs some assistance, they kept deferring me and pushing it off and saying, I'll be there in a moment. And a moment went from being 60 seconds to being 5 minutes, to being 10 minutes, to being 15 minutes, to being 20 minutes. Like, I'm sorry. Go ahead. Go ahead. No, I'm getting angry.
Well, yeah. The doctor came in, and as soon as she saw me, she said, we need to go. And so they like unlocked the bed, and everywhere else I had been transported in a wheelchair. But this time they took the entire bed and like started literally running down to the labor and delivery room. And I'm like laying down in the bed, still having contractions, but I feel like breeze going across my face. And I was like, are we running? And he was like, yeah, but it's fine. And so I'm like, you know, what's going on?
That was the word of the day. Fine. Babe, it's fine. Don't worry. It's fine. All is fine.
Yeah, because he was really trying to just keep me calm. It was not
fine at all, yo. It was not fine at any point.
Yeah. So I was just breathing through the contractions, but I mean, it was hurting a lot. But I'm thinking like, you know, I've gone to these classes and I've seen like the typical time that it takes for you to have your first baby is 24 hours. And so the level of pain that I'm in, I'm like, I cannot take this for 24 hours.
It takes 24 hours after what?
On average.
Damn, I didn't know that.
Yeah, that's what they said in the
I mean, I ain't know that. I'm listening.
wasn't listening.
But them classes was like 3-4 hours
It
long.
was
Boy, I was so ready to go. Every single class.
Too.
Yeah, after work. You gotta get there at like right after work. Yeah, you gotta leave work and go straight there, and then be in there till 10 o'clock at night.
Like, yeah.
No.
But so I'm thinking like I can't take this for 24 hours. Like that's like a no. Like I'm breathing through it, but 24 hours more, like it's not happening. So that's why I was like, can I have an epidural? And they were like, no, like the baby's coming now. And I was like,
but it worked out because the entire time
I didn't want
you had
one.
been saying you didn't want one.
I wanted to say, and I had told my doctor, I was like, I want to at least, I don't want to go in asking for an epidural. I want to go in, I want to see how it is and see like how much I can handle before I ask for an epidural, or if I'm going to need to ask for one at all. Because in the research that I had also done, I had seen about the effects of the epidural on mom and baby in that first golden hour of bonding. Like I was very excited to like bond with the baby and do that skin to skin and get him right on the breast like right away. Like all of these things that can be hindered if you have an epidural. So that's why I didn't want one. So in the end, when I didn't get to get one, it's kind of like, good, whatever. But I mean, I think it's really good that we didn't get one because he was premature and he already was like fighting so many other things. Like,
so, all right. Yeah. So I'm going to say this.
So we fly down to the room.
I'm going to say this one part real quick. Like it goes with this, but it don't. So we have our TV set to turn on in the bedroom, and it's on like headline news every morning, right? But with Rob and me, but every night it's all murder mystery, 100% murder mystery. And like 2 nights before, they were talking about this nurse that was working in the NICU. At different hospitals. She kept hopping around and she kept using muscle relaxers and giving it to babies, which would prevent the baby's heart and lungs from working properly, and these babies would unfortunately pass away until eventually they caught this lady. Now, with Atlas being 2 months early, the one significant issue that he had like a bunch of small issues, but the one significant one was that his lungs weren't properly developed, which means if she did get that epidural, which is a muscle relaxer, we could have been in it's more than just a muscle relaxer. It's like
it's a paralyzer.
So we could have been in far worse of a predicament than we were actually in. So you're 100% right. It really did like help us out. And I'm sorry to tell y'all that crazy story about that crazy insane woman.
So yes, we literally run down to the labor and delivery. You were running too?
Yeah, I had to keep up. I had purses and clothes, all kind of stuff in my hand. Yeah, I was running. I asked them if they wanted me to push the bed. Yeah, I'd give it up to them, to the little nurse. None of the nurses were over like 5'3". Yo, they was moving down the hall. Like the woman that was pushing from behind, she couldn't even see over the bed. Her head was low, and the other women were yelling out directions to her as to turn and stuff. I was like, this is insane.
I did hear because the one lady that was
when we got to the room though, we had taller nurses.
The one lady that was taking care of me in the high risk unit was older, and she was on the bed running with the bed too, and I heard they kept asking
she was
her,
the one that was running with the bed. Yeah,
they kept saying
she's the one that couldn't see over it.
Oh, that was her.
Yeah.
Oh, okay.
Yeah. Grandma was in there doing her thing.
Oh, okay.
Also taking her time to come.
Yeah, that's what she should have been doing her thing. Yeah.
There's so much woman power in that thing, boy. They was ready to go.
You were the only man in there.
I was the only man in there, yeah.
They were like, as soon as you have the next contraction, you need to push. And I was like, what? No. And they were like, yes. Oh, yeah. But they say that back labor is worse. I haven't had front labor.
Try to talk herself up. You know I was in the worst of it. You know I came through strong.
You know I didn't have epidural, right? You know it was back labor. Hey homies, don't forget to hit that like button. Plus, if you are at the end of this video and you're not subscribed, you already know what to do. And don't forget to hit that notification bell so that you don't miss the next part of this story or any of our other videos. Thanks for watching. Bye.